Did you know that 1.25 million Americans in the United States have type 2 diabetes? Well, if that's not enough to scare you, 29 million Americans had type 2 diabetes in 2015. Diabetes is currently the seventh leading cause of death in the United States. The number of Americans diagnosed with diabetes has nearly tripled in the past 20 years. Type 2 diabetes is a chronic condition that affects the way the body metabolizes glucose. This disease makes it difficult for the body's cells to absorb and use insulin. This increases your risk for many health problems, like kidney disease, high blood pressure, stroke, gastroparesis, DKA, and foot, skin, and eye problems. But with lifestyle changes like a healthy diet and adequate exercise, this can actually be prevented and even reversed. This graph above shows the proportion of the United States with type 2 diabetes. This graph compares age, sex, and ethnicity. Males and females of the ages 65 to 74 seem to have the highest prevalence. Males and females under 44 years old have the lowest prevalence. It shows that the African American and Mexican American population have the highest prevalence of type 2 diabetes. Male and female Caucasians have the lowest prevalence. This next graph is the factors that contribute to type 2 diabetes, like lack of exercise, an unhealthy diet, smoking, obesity, stress, and even genes. This next graph shows the correlation between body mass index and the relative diabetes risk. Therefore, the lower your body mass index, the lower your relative risk will be, or the higher your body mass index, the higher your risk will be. So due to all the preventative measures that can be taken, there should be an increase in federal and state funding for more research and programs. Now that we know the ways that we can reduce the risk for developing type 2 diabetes, are we going to make a change?